get started and welcome everyone. It's such a pleasure to see many of you and hopefully have wonderful conversations with all of you. So this is sort of the official welcome and start to the Digital Animal Summit's virtual meetup for May 2020. I want to thank our sponsors, our gold sponsor Folio 3 and our other sponsors AgriBeef and Progressive Beef for making this all happen. You know, this is the first slide I put up last year when we all met in person at UC Berkeley, that welcome to the Unsummit. This is always going to be, always has been and always will be, whether it's virtual or in person, the Unsummit, where we have lively conversations and all of us learn from all of us. And I think that's going to be very much the motto for the next couple of hours here. So we have a very nice packed agenda. The first panel from the production animal world is titled Safety First, and it'll be starting in just a couple of minutes. After that, we have the Innovation in Companion Animal panel, where Hillary will be leading, again, a group of experts and industry insiders and talk about the drivers of growth, focusing on wellness, preventative care, and of course, AI machine learning. Then we have a very nice surprise and treat for everyone, because we've managed to get 4 great startups to come and pitch to a panel of seasoned investors here. Sebastian Lafon will lead that, the pitch fest there. And then finally, I am going to host the keynote for this meetup, fireside chat with Martin and Spencer and Terra Capital and Payne Schwartz to talk a little bit about what investors are seeing, what's going on, what's hot and what's not in and around digital animal industry. So that's the agenda for today. And I'm going to actually stop sharing my screen, and I'm going to pass the controls over to the very first panel and to the moderator, Abdullah. I see everybody's in. So I just wanted to welcome everyone. We have close to 100 participants, and we will start with the very first panel. Over to you, Abdullah.
Thank you so much, Umair. Welcome, everybody. It's really great to see you all. I see a lot of familiar faces, you know, interesting backgrounds, virtual and real. So yeah, really good to see you all. You know, I welcome you all. So let's start, with our first panel, and allow me to introduce myself. I'll do my introduction, and then I'll pass it on to the other panelists. We've got a wonderful list of panelists here. Great experience coming all along. So myself, Mohammed Abdullah, Senior Engineering Director at Folio 3 Software, and I'm heading the AgTech practice and also the animal care practice here. One of the founding members of the Digital Animal Summit, and I also am one of the advisory council members. Folio 3, we've been in the software space for over 2 decades, and also in the AgTech space for a very long time now. And we've helped many companies in the AgTech space. We've helped them and just industry leaders with digital transformation, strategy, and implementation. I'm based out of Toronto. And as I said, we've got an excellent panel here to talk about production animal protein industry and how they're embracing digital transformation, and what our panelists think about the challenges and the opportunities that we all see in the coming days. Now I ask my panelists to introduce themselves, share their profiles and roles, and tell us about themselves and who their customers are. So we'll start with Alan Michigamba. Alan, over to you.
Thank you, Abdullah. Good morning, everybody. I am Alan Michigamba, and I currently serve in a business consulting role for a handful of organizations in the protein sector. Most recently, I was with the American Angus Association. Prior to that, I was with Zoetis and Pfizer Animal Health. And actually, the panel this morning, both Rodrigo and Paulo are former colleagues, and I work closely with Heather Donnelly as well. So it's kind of like a family reunion, but better because it's not. So I'm delighted to be here.
Thank you so much. Thank you so much, Alan. Heather?
My name is Heather Donnelly. I'm the Vice President of Operations for Progressive Beef. Progressive Beef has a program called Progressive Beef that is really a quality management system to provide verification and transparency for feed yards. We have 58 feed yards over the country in our program, about 1.7 million head of fed cattle. And I want to know, Alan, how I can get a fancy background. So I do Zoom, but not video very much. So something that looks cooler than my car here.
I can take care of you, Heather.
And thanks for having me today.
Wonderful. Thank you. Thank you so much, Heather. Paulo?
Oh, hello, everyone. Thanks for having me. My name is Paulo Loureiro, veterinarian, working with zoids for the last 3.5 years. I'm 25 years in agribusiness. I'm originally from Brazil. So in zoetis, I am with the technical team from the global commercial development, livestock, so all species livestock. Happy to be here and interested to know more about, innovation and share some perspectives.
Great, thank you. Thank you. Rodrigo?
Hi, Rodrigo Carranza. Like Alan said, it's nice to see some familiar faces, people we've worked with in this Brady Bunch arrangement here on the screen. Yeah, I'm originally from Bolivia. I've been in the U.S. Industry for about 20 years, most of my life in the animal health space with Zoetis, Pfizer before that. I worked with Boehringer Ingelheim on the Latin America cattle marketing team, and now recently with Diamond V, part of Cargill. We have a division that I run that is does some work similarly to what to Heather runs on the Progressive Beef side, but it's focused on the dairy. It's called the Dairy Quality Center. We have about 600,000 cows represented. There's about 150 vets that are certified verifiers and certifiers. So it's a program that's a verification, certification, and continuous improvement focused on helping producers think about themselves as beef producers as well. As you all know, cows change career paths at some point in their life, and they go from the milk supply to the beef supply, a very important part of the beef supply. So that's what I run today at Diamond V.
Right, so you're in career counseling.
Yes, sir.
All right, wonderful. So, we all have been through a lot. Everybody's been through a lot in the past month and a half. A lot of people, never worked from home. And I was speaking with Paulo the other day, and he was saying, it's very different for me. So we all know, how this is turning out. So my first question, Alan, to you is, how's the experience been for the industry overall since the, COVID outbreak, and how is the industry taking it?
Yeah, I will. I'm going to, I guess, echo what Dumair said earlier when he put a slide up about the unsummit. I would say the way business is right now is all about uncertainty, and what I think is interesting and exciting is watching organizations that adapt and realize the world's going to be a very different place now. So as those organizations do that and that are doing that now are the ones that are going to be successful whenever we slowly come out of this situation we're in from a work environment. You see other organizations, or I do, that seem to think nothing's going to change, and I think that's what's at stake, because there are going to be a lot of changes, and from everything from the amount of travel we do to the amount of remote work we do to the way we interact with our various colleagues. So I see it as a time of opportunity, an exciting opportunity, but nonetheless opportunity, and there's risk.
Yeah, no. Heather, what are your thoughts?
So my thoughts are, for us, it's absolutely, I echo those sentiments. Like, for us at Progressive Beef is an opportunity to look at our processes, change them, get better, streamline them. We need to be on site at feed yards. So that has been a challenge for us because we're all over the United States. We can't get into these feed yards. We audit them. And so we have to still maintain business. So we've had to adjust our practices to get these audits done when they need to be done, but at the same time, because of that uncertainty that Alan talked about, we are not top of mind for anybody because they're trying to keep their employees safe, make sure they have a workforce at these feed yards. And of course, right now on the fed cattle side, they're just trying to get cattle to a plant and stuff is backing up. So it's really trying to understand how our people at the feed yards are feeling also is impacting what we do and how we do it, and prioritizing, being like, okay, this is not important, or just having extra customer service to just do stuff for them because that's what they need to right now to get through stuff.
Yeah, comforting all of them and, you know, just being there for them is really important for all businesses at this point. Paulo, you know, what do you think?
Well, I think that nobody could predict what we're going through. So it's new to us from animal health industry, for any industry in the world. And if you think about food production, as Heather was saying, we need to take care of the animals all the time. You cannot say, oh, I cannot go see you, I cannot go and feed you. You have to be there. So from that standpoint, what we're doing is to be being present as we are requested. Sometimes customers ask us to go, and we take all the, the precautions to be there and help them. But we also are doing a lot of this video conferencing, education through video, which you have to do, helping them to continue to be engaged, motivational stuff. You have to do that. Bring people in and say, we understand what's going on there. We are here to help. We offer our expertise, and this is a great tool so you can be present all across the globe, and maybe in one day you can visit 5 countries with this and help customers on a daily basis. So I also see that for us in animal health, we see how critical is the work we do to support people in the field, and also to provide to workers and the animals under their care everything we can in order to help. So today, I think we need to be, the word I will use is compassionate, be there for them and do what we can, because while I can be in the office or here in my home office, the people in the field, they have to go see the animals. They have to make sure that everything is in place. So it's impressive what people are doing today.
Wonderful, thank you. Rodrigo, you want to add to that?
Yeah, I mean, not much more to add. I think it was well said. I think the only thing that is interesting is I have the same challenge. I think when I was working with BI in the Latin America market, as Paulo would know, there's a lot of places that are hard to get to, right, in Brazil and other countries. And we were constantly trying to figure out how do we reach them with technology? How can we do virtual visits? How can we get some of their records and help them out? And I see that this has accelerated that need. And now we're starting to do that by need and finding ways, as Heather said, finding ways to get on the farm. This whole business, all of our businesses depend on us being feet on the ground, being able to see and help the producers. But this has really helped us think of how can we be more nimble? How can we find other ways? And very appropriate to this discussion today is how can we use technology to better approach our customers and do our business slightly different. So it's accelerated things that we wanted to do. One thing that I would say has not changed that's been encouraging is that the consumer is waking up a little bit to, hey, here in the US especially, is we're just used to going to the supermarket and finding food. Have no idea how it gets there, don't care in some cases. We just care, that it was done right, but we assume that it's going to be there. And now this is helping people think a little bit more about what goes on to get food to their plate and what the farmers have to do in order to produce it. And so consumers are also, however, still very interested in animal welfare and making sure that production is done appropriately. They do want to know where their food comes from, and this again has accelerated it. So I think opens up a lot of opportunities as well.
Yeah, thank you. So Alan, one question for you on how the consumers are seeing this. I mean, I've since we all got into quarantine, I've had a lot of beef, and I think I'm more beef than human now. But once the pandemic is over, How do you think digital technology will really impact consumer knowledge and confidence as to where the protein is coming from, and how would they look at protein purchases now?
Yeah, I think it's a huge opportunity for the industry and using digital. If the power and impact of digital information, if it wasn't already unleashed, it's been fully unleashed the last couple of months, right? Digital allows retailers and food service in this case to provide a lot more information to consumers, to be more flexible about it, to do it on a as-need basis. I'll give you a couple of examples. So my local supermarket emails me 2 to 3 times a week with recipes, specials they're offering, information on their producers or suppliers, whatever the case may be, right? But contrast that with the weekly mailer that we all get in our mailbox we've been getting for decades, right? That mailer, I believe, is going to lessen in importance, while providing it digitally will allow a retailer, in this case, provide a lot more information, right? And a fraction of the cost, and probably much more efficiently when it comes to terms of return on investment for sales. And the other example I'll give you is my 83-year-old mother, who actually lives on the ranch that's in my background right here. So she uses an app to develop her weekly grocery list, right? Then she transfers that content to her retailer's app or the grocery store app and fills it to fill the order and then schedule her pickup. And she does this without even a high-speed connection, right? And she's 83. I mean,
Wow.
See how it's changing. She's not an early adapter. Let me put it that way. So you can see how things are changing. I think it's only going to continue to change as we've learned, all of us learn to become more adept at using digital.
Oh, yeah. It's really, really good insight. Rodrigo, the beef supply chain, how do you see that being disrupted now? And you mentioned about getting more nimble. So how can technology really help? And, what do you see, what the industry can do now?
Yeah. I mean, we a lot of us here on the call, we are in the industry. Maybe there's some that are on the technology side looking into the industry. So I'll just speak a little bit to how it's been affected. As you guys know, over the years here, at least in the United States, we've consolidated a lot of the processing capacity into a handful of key packers, right, on the beef side. A little less so on the dairy side, but still held by some major processors. And so that's become highly efficient and low and reduced cost and whatnot. But in this situation, it has made us very fragile. Now it's still being held together. It's still moving forward, but it certainly provides a challenge. So I think being nimble coming out of this I think there's going to be much to what Alan mentioned. The shopper connectivity to their supermarkets is maybe even go further in their connection of the consumer directly to a processor, or furthermore down the supply chain down to a producer. I have an ex-colleague of ours, Alan, you will know her, Jenny Schutte, that she is a small beef producer in Tennessee, and they market their own beef. And they've been doing it the old way, they have a trailer that they take to a local, to the town and to a parking lot, and they kind of put out a newsletter and social media for people to go buy. And now they can't keep product on their shelves, so to speak, with the demand of and people looking for them. Now there's no good way to connect them, so there's technology opportunity there to connect consumers with some of those local producers that are producing beef or producing other goods. Not to mention, not to say that it's going to supplant obviously the larger supply chain. We need that in order to get it all over the country and feed our growing planet. But definitely those things are going to change to figuring out how we could have some more local supply chains, more regional supply chains. I work with two pretty large regional supply chains. Our partners, Cavaness Beef and CS Beef, great companies that process more locally, for example. And working with those and having access and relationships with them through digital technology, I think, is going to be enhanced by what's happened.
Yeah, thank you for those insights. And this is in line with, I was speaking with Jay Thieler. Unfortunately, he was not able to join us on the panel today from AgriBeef. But he was mentioning this, that, having a solid e-commerce presence and, directly reaching out to consumers has been, has really shown how important it is in the last couple of months for them. So yeah, really, really will change how businesses are reaching out. Heather, you've been implementing technology at, far-flung areas of the country and reaching out to areas where, even cell coverage is not there. So how is, what have you seen? What are the keys to be, successful in technology implementation in the industry?
So I think to be successful in the country, and we have a lot of basic challenges on just connectivity. They don't have good internet, or their facilities inhibit some of the connectivity that they're in. And so once we get past that, and it's just the human side on some of these. So I know Alan talked about his 83, his mom doing that, which is awesome. My mom has not gotten to that same level yet, but it's getting those people to embrace it. It's change, right? It's different. And it's trying to tell them the why we're doing it, but then also keeping it extremely simple. I think the app that we use for Progressive Beef in the field, I mean, we have young guys that are, and gals, so in their 20s to, the sky's the limit there. And we spend more time with the older people on figuring stuff out, but it's that human interaction that determines our success in the field, on taking the time to understand what's important to them, and then just their challenges and the circumstances. So like with the COVID stuff today, there's so much going outside in the yards that for us to understand that helps us implement some of this technology with them. But it's going to be absolutely critical going forward, and like the technology that we use is going to help, like Rodrigo had said, connecting those production practices and what happens on the ground with that consumer. Because before, they just went to the grocery store and like, I got beef. Now they were forced almost to try to understand what happens before the grocery store. And I've seen a lot of ranches or smaller feeders pop up where they're selling beef, but like in my local community here, small community in Kansas, 2,500 people, our local butcher, which we have one, they are booked out till January of 2021. You can't even get a spot to get. And I've talked to other communities around here. It's the same everywhere. Everyone's talking to that rancher, farmer, feeder, and booking a slot.
Wow. Yeah, that's really, really interesting information there. Paulo, you've been in precision farming, right? And you've seen that a lot. And so how do you think, what should be the key focus on animal health when it comes to precision farming?
Well, I was listening to Rodrigo and Heather, and I will continue on that same topic in transition to precision livestock farming. So think about what they just said. People want to buy beef. People want to, have access to that, and they can't. So this is a big, opportunity for the industry. We know that, like Rodrigo explained, is happening in the US, happened in Brazil, happened in Australia, consolidation in the packing industry, so in the packers. So I see more opportunities. So maybe we're going to have more labels, independent labels, and someone else is going to open, new packing plants, smaller packing plants, who knows? But this has to grow because we know how people rely on us for production, for protein production. And so then think about precision livestock farming. I'm very curious about this area for a long time. I had the chance to, when joined Zoetis, to work closer to that. We need to, of course, tell our story to consumers, why and how we do what we do. So the why, I think they know, because they feel the need to have access to this amazing, food. But how that food comes from the farm to the table is a big question. So think about traceability. Food, this is key to understand how we produce beef, So think about also how we do what we do in the farm level, animal welfare. I like better to say animal well-being. There's a misconception sometimes that people think we don't take care of the animals. I think we do a great job there, and we have some things we need to improve. So the more transparency you get in the system, how you can show what you're doing, the better for us and the industry. We're going to, of course, be able then to correct the mistakes that are being done, maybe for lack of training, for lack of knowledge, whatever that is, we can fix, so we know how to fix. And then we also can showcase what we do well, and we do a lot of great things. So animal well-being is key. So when you think about precision livestock farming, if you can detect animals before they get sick, it's amazing. So they are going to get sick because, unfortunately, you know, when you have animals came together, you move animals from farm A to farm B, and they come in with animals they don't know before. I'm listening to an echo here. I don't know. So maybe, okay, thank you. And that increases stress, you know, uncertainty, and they get sick by, you know, lack of some issues with the immune system. So what we can do is, if you understand animal behavior in a higher level, like for cattle, and you can do for swine, for birds, you can, by the behavioral change, you can intervene. So think about animals that are not drinking water properly because they don't feel comfortable in a new home. And if you can go there and work with them, make them comfortable in that environment, again, they're probably going to drink water. But if you don't know if they are drinking or not drinking water, it's just a simple thing. They can get sick because they're shy. They don't want to approach the water bunk. So with food is the same. So what I'm saying is, if you can track animals properly, if you can understand animal behavior and translate that into information accessible to me, to you, to any specialist, you can really see what's going on. Algorithms are also a great tool, but you have to have people to interpret what the algorithms are telling you. So I believe very much in the future. And if you have a good idea, please bring that forward. The more we understand about the animals, the better it is to prevent diseases. So I think the biggest focus for for precision livestock farming, one of the biggest areas, and maybe the big blockbuster will come from detecting, you know, early sickness.
Yeah, very valid point. Yeah, and you know that ties in to biosecurity as well, right? So you know, with all the contamination that is, you know, if God forbid that happens, if you have that information beforehand, as you mentioned, you know, you can trace where it's coming from. Then it really becomes, you know, easier to go back and make sure you're proactive rather than reactive on that.
Yeah, and then you can integrate nutrition with animal health in a seamless way, so you can have a clear vision about what's going on and provide full transparency to whoever want to see what we're doing.
Yeah, no, valid points, valid point. So all the, you know, participants here, I'd just like to mention that we'll reserve, you know, we've got about 10 minutes left for this panel, but, you know, I'd like to keep 5 minutes for questions from, you know, participants. So if you want to ask a question, just post it in the Zoom chat window, and we'll pick up those questions and, you know, and pass it on. If you want to ask a question to a specific panelist, please mention their name. So Alan, you know, you mentioned reaching, you know, directly consumers reaching out and buying and getting more aware on what they're buying. Do you see now that, you know, they'll be more conscious and they'll be, you know, they want to verify what the producers are claiming, you know, the product to be? And is there a digital approach to verify all of that?
Yeah, absolutely, Abdullah. And as Heather and Rodrigo both mentioned earlier, people want to know where their food comes from. And even more so now, they want to know how it was produced, right? So you start, or the industry starts with traceability, but the next step in traceability is going to be a digital piece called the single distributed ledger technology, or blockchain, if you will, right? So blockchain allows data sharing and data verification for people up and down the supply chain, for all the way from the initial seed stock producer, perhaps to the retailer, the food service entity as well. And there's a lot of benefits for that. Number one, of course, is transparency to the consumer. They can validate that how the animal is produced, not just based on claims, but there is a verification process. And then also from the production side of things, that data sharing, data streaming and that consensus, if you will, to share data allows them to identify potential improvements in efficiency, which in turn will enhance sustainability. So blockchain's been a kind of a catch-all phrase used the last couple of years. You don't hear as much talk about it right now because we're on to the latest new cliche, but nonetheless, there's a lot of great work being done in the agriculture sector regarding blockchain. And as that all comes together, it just helps our story even more so.
Now we have, good points there. Good points there. And this relates to my next question that for, Heather, consumers want this, traceability and more information and credibility on what's being labeled. But then, on one hand, you have this transparency, but then, businesses want confidentiality as well. So how does technology really help, can help balance the two?
So you are correct. At least on the beef industry side, they're very protective of their information. And sometimes I feel personally, it's just an awareness of understanding that the questions or the information the consumer wants is not necessarily to get into our business. It's just they don't know. And so they want to know. So it's using then the technology to give that transparency that the consumers want, but allowing the producers to select which information is given, or to take that raw data and put it in a form or a report or information that is easily understood to that consumer. So it's the best of both worlds. And then just hopefully, and I think it has to be a gradual transition, as even though it's the beef industry, within that supply chain, there's a lot of competition with each other, which I think after this COVID-19, I think we need to do a better job of working together. We're on the same team, right? Like football, if the lineman's pushing back turns around and takes out the quarterback, that doesn't do any good to get the ball down the field. So we need to work together and just take a step back and, be transparent, but then protect our information at the same time.
Good. Yeah. No, those are valid points. It's a delicate balance, but I think we'll all learn as we go. Sometimes consumers won't be happy with the lack of information, and sometimes businesses won't be happy to release a lot more, but you gotta balance that. Rodrigo, I've got a question for you from the audience. There were two similar questions there. People are saying that, what's going to happen when there'll be a sharp decrease. Are you guys seeing a sharp decrease in beef consumption? And then, there's another question on the alternate protein side. So is that still a threat? It was a huge thing before COVID that alternate, protein, lab meat is going to take over. How have you seen all of that happen and, unfold in the last 2 months or so? And how do you see the future?
Was that question to me?
Yeah, Rodrigo, yeah.
Yeah, sure. Save the really tough one to me. Thanks. I'm having just a little bit of problem connect. I just wanted to make sure. Can you hear me okay? I'm cutting up a little bit.
Yeah, we can hear you fine now.
Okay, perfect. Yeah, that's a really tough question. I think from what we have seen, right, is there is that is definitely was something that was getting a lot of traction and a lot of media play. And what we at least have seen now, and Alan and Heather are also very close to the beef supply chain as well. They can mention, but I've actually seen that quiet down a little bit, and we see, we've seen reports of supermarkets having a hard time keep shelves full of beef, traditional natural beef products, and some of the other plant-based, some of the other products that are that are like plant-based proteins. Not obviously the lab meat is not something that's out in supermarkets, so it's hard to tell how that is moving. But I think a lot of folks have moved to the traditional supply chains where they know the area that what there. Obviously, what we're about, and this just a week ago was on the Animal Ag Alliance conference and discussing these topics. And a lot of it is going to be providing the choices to consumers, so that there is going to be a place for a lot of these different technologies. It'll be interesting to see if those same consumers that are looking for cleaner labels, more natural, looking for less ingredients in their products, are going to adapt or adopt meat that's grown in a lab, or products that have very large ingredient lists in their labels. That'll be interesting to see. But at the end of the day, we still see that health, price, and taste are the three biggest consumer reasons for purchasing. So I think there is going to still be some growth there and opportunity for those that for those reasons pick those products. I think there is going to be room for all these different alternatives. Our consumer looks for choices. So that's my take, but I don't have the crystal ball.
Oh, thank you so much for that. And Paul, coming, similar challenges that we've discussed here. Do you see that, coming from Zoetis, you guys have a global, view of things over there. So have they been the same around the globe, or, are they different, based on different regions?
So, Abdullah, your question is more related to what's going on now with food production, or you're talking about technology like precision livestock farming and
food production? Yeah, it's more around food production.
Okay, food production. So I think there's some areas of the globe. The COVID pandemic is not happening in the same, let's say, speed across the globe. So you see here in the US, unfortunately, we saw some issues with, shutdowns in packing plants, which I think we need to respect. The authorities, if they're saying we should slow down and manage, which is not easy for us, but we have to do that. But then you see countries like Brazil where the operations are still full speed ahead. You don't see any kind of, let's say, big issues right now, but we need to be vigilant because that can happen. But nobody stopped to seed, crops. So I think the grain production is still going well. I had some calls in Australia, and I saw they're doing a great job there, in planning how to do it. But everything is happening so fast, and certain markets are not taking up, import, beef import or other meat import so fast. And so you have some delays. Like now in Brazil, if you go to a packing plant and ask where they're selling beef, probably 50% of the cattle is being exported to China, which is buying a lot of beef today from Brazil. And the price is stable, very firm, stable for the producer, and unfortunately for the consumer is going up. So we as Zoetis, we are supporting farmers across the globe. We see our operations still working perfectly. Of course, you cannot go to the farms like as we should. We're doing more of this kind of remote working, but our tech services and our sales reps are contacting people all day long. So this is happening. Business continuity remains. Our manufacturing plants are working. We have no issues so far, and we are still, very optimistic. But we understand that it's a difficult phase for everyone, for all the industry, for entire industry. But we are essential to food production, so we can't stop. But as I was trying to say, it's not something happening at the same speed and in the same level across the globe. You have big differences right now.
Right. Thank you so much. I see quite a few questions that we have from the audience. I wanted to ask a lot more, but unfortunately we're short on time here. And had it been, the March event that, we were supposed to meet in person, and I think we did the right thing by postponing it. But, really looking forward to our, next session where we can get together in person and, have a more intimate discussion on this. As I said, a lot more questions here, but unfortunately we can't take them. We'll see if the panelists, can take time and answer these questions, and maybe in our next newsletter, we can address that. So with that, I'd like to thank our panelists here. Thank you so much for your time. Thank you so much for the great insights that you brought to the table. And I'd like to pass on to Hillary now, Hillary Jensen, to take over and start the companion animal panel. Thank you so much. Thanks a lot, guys.
That was a
Thank you.
fantastic
Thank you.
Thanks,
discussion.
Abdullah.
Thank you, Abdullah.
Thank you all.
Really
Appreciate it.
interesting. Yeah, thank you. I figured out a new game for Zoom, and that would be who are the doppelgangers of famous people. I think Rodrigo Carranza looks like Alec Baldwin on camera. Anyway, so really glad to see so many familiar faces, and thanks for taking the time. So what we wanted to talk about today is the huge growth potential and the rapid change in companion animal diagnostics. And so much of that is due to changes in technology and having data that we haven't had access to before. I'll introduce myself and then have our panelists introduce themselves. I'm Hillary Jensen. I Stanford undergrad, Harvard MBA, software executive who with experience at Google and companies like LoopNet, and decided to try to help my dog live a longer, happier, healthier life. So founded Obi, Digital Dog Wellness, out of love for him. And he's passed away since then, but lives on in spirit in the company. And we are shipping, and well, actually we're out of inventory now. We are live on Amazon, Chewy, and obidog.com. And the reason we fit into the companion animal diagnostics conversation is that we measure and monitor eating and drinking habits, and we're using AI and machine learning to help with predictive diagnostics that can help with early diagnosis of health problems. So that's my spiel. And I look forward to hearing from our other panelists. Janine from Kinship had a family emergency. Everything's okay, but she was not able to join us. So sorry about that. Aaron, do you want to introduce yourself?
Yeah, thank you, Hillary. It's really great to be here, both as a emergency veterinarian as well as an entrepreneur and co-founder. So my journey in vet med began in high school, where I started out. My first job in a veterinary hospital was being the janitor in a small clinic in Pennsylvania. And then it took like a 15-year journey of rural veterinary medicine as a technician to large specialty and emergency hospitals, and worked my way through several different roles as a technician there, and really fell in love with emergency medicine and found myself really on the admin side of things. Went back to grad school, got a degree in toxicology, and then was fortunate enough to get accepted to Colorado State's combined MBA DVM program, where we'd go to vet school all day and then walk across campus and go to business school at night. Where, in that cohort, we founded Lacuna Diagnostics, which has been a very exciting journey for the past 4 years. Lacuna is a B2B business. We've digitized the microscope just like radiology digitized the X-ray plate about 15 years ago. So traditionally, a doctor, a veterinarian needs to send a microscope slide out to a laboratory. It's a box it up and ship it, or a courier picks it up and sends it to a lab. It's a 1 to 5 day turnaround time on average across the country. By us digitizing the microscope at a point of care solution in the hospital and uploading it to a team of pathologists around the globe. I took a look this morning on our stat service, which we call Right Meow. We're averaging 9-minute turnaround time, and on our high priority, we're averaging 53 minutes. So really the problem we solve is, one, we believe that time is trauma. So being able to diagnose accurately and getting treatment started is obviously better for the pet. I can't think of one reason as a veterinarian why that wouldn't be better. And then two, for the pet parents, we never want to be a Friday on a 4th of July weekend and say, hey, your dog might have an infection or it might have cancer. I'll tell you in 5 days, and then we'll get something going. So really a pleasure to be here, guys. I'll throw my email into the chat channel in case I can answer any questions afterwards.
And mute. Holly, do you mind introducing yourself?
Happy to. Hi, I'm Holly Gans, and I am a microbial ecologist. I co-founded Animal Biome, which is a startup focusing on the gut health and now actually oral health of cats and dogs. I did my PhD at UC Davis studying host microbe interactions, and then postdoc at UC Berkeley, where I worked on wildlife disease ecology and became introduced into the sequencing methods used to sequence the microbiome with collaborators at the Lawrence Berkeley National Laboratory. I decided after my postdoc that I wanted to try and apply microbiome research to companion animals and took a research appointment at the UC Davis School of Veterinary Medicine, and then ultimately ended up working at the Genome Center at UC Davis, where I started a citizen science project with Jonathan Eisen called Kitty Biome, where we basically just asked people through a Kickstarter campaign if they were willing to support us to cover our sequencing costs. Didn't cover salaries or anything like that, but to just explore what the microbiome looked like in cats and how it varied in disease states. The reason I went to Kickstarter was because at that point it was very challenging to get any research funding for microbiome research for companion animals. What I discovered was that there was a whole community of people who had felt trapped on sort of a medical merry-go-round of antibiotics, steroids, and prescription diets, and they had refractory cases. So they were looking for something new and willing to spend their own money on microbiome research, even though we said we couldn't promise that anything useful would come out of that project. What I discovered, though, was that in these cats with chronic diarrhea, chronic vomiting, and chronic constipation, that there were biomarkers in the microbiome that I thought might be useful for creating new diagnostics that were less invasive based on fecal samples to replace the sort of standard practice in veterinary medicine for things like IBD, which requires invasive biopsy sampling, which many general practitioners will not bother with because it costs $1,000 or more and often doesn't alter care.
That's great. Thank you. And then Jamie, are you still, I don't see you right now, but Jamie from Covetris?
Hi, Hillary. Hi, everyone.
Hi.
What an interesting opportunity here. It's like Hollywood Squares times 1,000. It's really great. Thank you, everyone. It's so great to see you. My name is Jamie Carroll. This is my 25th year in animal health now. Hard to believe that. I started out with the intention of becoming a dairy vet, and then I spent some time with a dairy vet, and I thought, well, this is absolute madness, and changed my course at that point in time. But landed the beginning of my career at IDEX Laboratories, where I spent 15 years. Started out in research and development, primarily on the poultry and livestock side, and then held a number of commercial and general management roles, including the general manager of the telemedicine division for a number of years. I then went to join a company called LifeLearn outside Toronto, up in Ontario, and spent 6 years there, serving 4 of those years as the CEO. During that time, we had a project with IBM Watson, and as a result, spent about 1.5 years on the board of advisors for IBM Watson, where we were trying to solve pretty significant challenges around how we use massive amounts of data, often that data being highly unstructured, to solve some pretty big challenges across retail, human medical and veterinary medical, a number of different areas. And then left LifeLearn to join, at the time was Vet's First Choice, and now has become Covetris. And so I'm now about 3.5 years with Covetris. I serve in the role of head of global supplier relations. And of course, I'm also very grateful to be a member of the board of advisors for the Digital Animal Summit and a member of the Leader Circle. So very happy to be here and see everybody. Real quick on Covetris. We're a publicly traded company, which is the result of a merger between Vet's First Choice and Henry Schein Animal Health, which happened back in February 2019. Our core business units include distribution, prescription management, data and insights, and software development. And we operate globally in about 25 countries, serving around 100,000 customers today. Diagnostics play a key role, obviously, in the operations of a veterinary hospital, and Covetris is a trusted distribution partner for key suppliers, but we also play a significant role in the interaction of management data and in-practice diagnostic equipment. We also provide data services to reference laboratory networks, and ultimately we look to help veterinarians solve the issues of gaps in care, where we can identify patients that are not protected against preventable disease and help veterinarians manage therapies that are specific to the individual patient. As a result, we serve not only veterinary practitioners, but also their pet owning clients. So that's it about myself and Covetrus.
Great, thanks. And we wanted to start with a background because we didn't want to assume that you knew all the players, and now you understand how we all fit in together. So starting off with the discussion around the history of where we were yesterday and how we are evolving to today, and we'll get to the future in a bit. But can you tell us a bit about how diagnostics, companion animal diagnostics, used to be, and some of the problems that are now being addressed?
Who's that directed to, Hillary?
It's been directed to either of the three of you, but go ahead, Jamie, if you'd like.
Okay, so I have to peel way back in history because I feel like it's been a long time since I was at IDEX. But I think early on, when we think about the history of diagnostics, I remember when pet-side rapid assays were a new novel invention, and IDEX went from creating the SNAP test it actually started out with something called CITE, which was a little barrel test using an enzyme like the immunosorbent assay approach, and that evolved into a self-contained reagent diagnostic called the SNAP test, and that was a really new novel approach. And it's interesting now because millions and millions of those tests are made on a monthly basis, and there are different other types of suppliers for those types of pet-side diagnostics today. But how did veterinarians get their work done back then? Well, it was still a matter of, from my perspective, the issue was always around how to drive compliance with diagnostics and compliance with medications. And veterinarians always struggled with this because if you think about the typical veterinary hospital in the companion animal sense, you're talking about a practice that's a small business. They don't have a digital marketing expert down the hallway. They don't have an oncologist down the hallway. And they're oftentimes are general practitioners. Yet they have patients that come in that, number one, don't speak. So they can't tell you where they hurt or what's wrong. And two, they could have anything from a cat or a dog or an iguana or a parrot or a horse as part of their clientele. So having to have knowledge of all those different types of species, the relative diagnostics that are required for those species based on the condition they're presenting with was a real challenge, and it's still a challenge today. The difference today is that we have more advanced diagnostics and we have better access to information to make good clinical decisions. So there's been a tremendous amount of evolution. I think we'll continue to see this. There's also different types of technologies that are really interesting, and Aaron at Laguna Diagnostics probably has some good familiarity with this, I'm guessing. But I remember when PCR tests were like a multiple day event to get a result. And now we've got almost what's called real-time PCR diagnostics that are available, where you actually get very definitive, highly specific and sensitive results in a matter of hours instead of days. So incredible innovation. And I think we'll continue to see that moving forward.
Yeah, I mean, just to echo that a little bit, I think we overlook the ecosystem of how veterinarians actually work. I mean, we talk in the business world all the time about speed and accuracy, but I mean, really, when you dial down to what they teach us in medical school, they're basically saying, okay, what are your medical problems that you have with your animal? How do you lump those medical problems together? Then what are your differential diagnoses for those medical problems? And then you rank those based on the history, based on regionality, based on everything. And the key point to figuring out what it is from those list of differentials is diagnostics. I mean, that's how we rule things out, and that's how we diagnose things. So if we think about that landscape or that ecosystem of how veterinarians get their work done, and then we put it into, 15 years ago, 20 years ago versus today, dog comes in limp. This is a personal example from 2 weeks ago. Dog comes in limping, took some radiographs, didn't see any fracture, didn't see any concerns, thought it was probably a soft tissue injury, explained it to the owner. Radiologist gets a hold of those radiographs, and guess what? There's a hairline fracture and a humerus. Well, 15 years ago, that radiologist would not have had access to those x-rays. Therefore, that pet would have went forward with 3 experienced emergency doctors not seeing this fracture in the humerus, where today that's rare for that to be missed, because it might get delayed. I mean, it was a 2-hour delay, and the owners were very happy for us to bring this to light. But I bring this personal experience here to just say, like, the history of where we were, of how we got our things done was, the clinical intuition and empirically ruling things out was probably more a part of a veterinarian's career 15 years ago, where now, I had an animal the other night, I probably ran 10 diagnostics on, 5 of which didn't exist 10 years ago. So to Jamie's point, it's not all about being better. It's just about having more options to get there to a more defined result faster, I think.
Hillary, can't hear you.
You're on mute.
Thank you. Holly, I know we've already addressed a lot of the reason you have founded your company, which is the GI problems that so many animals have. And my Rottweiler DJ was certainly one of them. I'd like to transition to the future now and the problems that you're solving today. And then what do we think in the next 5 to 10 years? How will the diagnostics market change?
So, well, from the point of view of gut health, I think it's already changing in veterinary medicine as well as in diagnostic tools. In the past, I think there was this focus on inflammation, and now they're moving towards sort of chronic enteropathies, which Aaron could fill us in more on that whole process. It's really, I think, a much better approach where they go through a sort of series of stages of trying to understand what's happening. But from the point of view of diagnostic tools, we're finding tremendous value in microbiome testing. I think there's also metabolites that are useful in addition to just what microbes are there, what are they doing. What we can also detect things like intestinal cells, and there's all kinds of things in fecal samples that can be used to try and get at things in a less invasive way. There are now cameras that you can put through the GI tract if you want to take pictures for inflammation. They're still a little bit big, I think, for cats and dogs, but they're coming for humans. I think at-home testing is very much something that people want. We just launched oral health testing, and I can tell you for cats, like having them have to go into the veterinarian's office to get seen for an oral exam is stressful for many of them. Of course, getting a sample of from their mouth can be challenging for pet parents as well. But I think that there's definitely tremendous demand from consumers for more at-home testing.
And I think that rolls into a question that Dean Larimore asked, which is the new data that we are able to have access to. Can we talk to the role of data science in the future of diagnostics?
Yeah, I'm sure just like Obi, Animal Biome has been investing quite a lot in building a database and collecting our data in a really good way, so that part of what we're doing is really amassing data, and the better job we do of it, the more useful it will be for things like the sort of AI that Dean Larimore is referring to. And it's really easy to not collect data properly or to store it properly. So there's data science is really foundational behind, I think, all of the companies that are really focusing on trying to build diagnostics. I'm sure Lacuna is doing some similar work. I don't know if you want to jump in on that, Aaron.
I bring these ideas to the engineers, and they're like, Aaron, it is not that simple. I'm like, well, how can it not be that simple? You've got this dog, you've got this history, you've got these diagnostics. But you're right, Holly. It's the worst thing could be you go back and look at that data when you need it, and it's not organized and it's not segmented appropriately, because then it's worthless. Because you can't, you either can't go back, or it's going to cost so much money to go back and resources to go back that it'd probably be better to start over. So yeah, I think that's a great point. I think a lot of people are working on this. I think there's a lot of cool companies working on the data side thing, everything from like personalized precision medicine, Holly, to, what we're trying to do. And I think it's extremely exciting because I think that data often isn't talked about enough as maybe one of the solutions to some of the other problems we have in vet med. I mean, look at what's going on right now. The essential workers we're getting run over. And for all good reasons, and we're happy to be there. But, I fast forward 10 years and I think, how could data being collected today help us be faster and more efficient in the clinics? It takes time to go through complicated blood work, and it takes time to go through complicated microscope slides. But if we're working on data correctly, which I hope a lot of us are, I think a lot of us are, what is that going to assist the veterinarian and assist the clinician and the clinical team to getting to a better and faster treatment plan for animals? So I agree. I think it's really important.
I just want to give one example from our work. So we've been working really hard to clean our data and build a really nice data warehouse over the past year. And then we've been surfacing insights. We submitted abstracts to ACVIM and AVMA this year that were both accepted, but then both conferences have now been canceled. So we're looking to publishing the work, but just starting with like, what is healthy in the microbiome for cats and dogs? Like, this is a controversial topic for human medicine, but we actually have the data to show that we can define healthy for cats and dogs. And then we can show how like things like Escherichia levels actually can be predictive of clinical signs for these gut cases. Highly significant. The best p-values I've ever had, like p to the, anyway, it's like 0.0 to the negative 12. And those are just the most obvious low-hanging fruit that you can start to pick up when you have your data in order. And we're looking to find more less obvious insights that we'll be able to, as our data set grows, surface.
I think it's a really interesting conversation here because the challenge of data is so broad and so deep. And I'm looking through some of the group chat notes here, and I just want to highlight something that Linda has brought up. And Linda, you're exactly right. In veterinary medicine, there is no data standardization across the different practice management software systems. And I think the landscape, I might be wrong on this, but I think there's approximately 26 different brands of practice management software just in companion animal health alone. And then there's more for equine specific hospitals. And if you look at just the North American market, there's somewhere around maybe 40% of hospitals are on the most current version of that particular type of software. So if you think about the lack of standardization, the broad variety of different types of software systems that are out there, and the lack of compliance with upgrading to the most current version of the software, you have it's a storm. It's a perfect storm of challenges with data and being able to understand in aggregate what's happening in the industry. So then you have companies like Covetrus and others that have started to dig into this challenge and really think about how do we normalize data at scale, of course with veterinary permission, to be able to look at insights into gaps in care and identify those on behalf of the veterinarian. And this is a core mission of companies like Covetrus, where we're trying to identify ways using technologies like cognitive computing to help normalize data at scale in a highly accurate manner so that we can help veterinarians understand, even within their own hospital, how many non-protected patients do they have for preventable disease? How many patients do they have that are coming up as lapsed on critical medications? And to help the pet parents stay current on those core medications, to stay current on their diagnostics. But today, if you look across even just the software systems that Covetrus owns, a lot of these fields for diagnostic codes and product codes are freeform in many ways. So now you have the additional problem of trying to normalize, basically open text type coding when you've got something like 15 to 20% turnover at the front desk area of any veterinary hospital too. So there's lack of standardization everywhere you look. It's a huge challenge, and but with technologies like cognitive computing, we'll make rapid progress here. And then eventually, it would be amazing. You could foresee a future in which, by amassing that information at scale, you might even be able to predict early on disease outbreaks by region. You might be able to even identify, as diagnostic codes are entered in for ehrlichiosis or Lyme disease in rural Michigan, you might be able to send out almost like an alert system to the veterinary hospitals to say, we're seeing an outbreak in this area of this particular disease. And how amazing would that be to be able to be proactive in outbreak scenarios? That's part of our future. We have to get there.
I think with with human medicine and the COVID crisis, they're finding that it's revealing all these problems with the way that the medical systems, the data is entered for in hospitals, and that it's basically, people are saying that they're designed more for billing and that kind of tracking than it is for surfacing these kinds of insights. How do you think it compares for veterinary medicine?
Is that to me, Holly?
Yeah, I guess.
It's a good question. I mean, when you think of billing, I don't really know. Actually, I wouldn't have the expertise on the billing code side of it, to be honest with you, and how that works in the different practice management software systems. But I think there's evidence of that being useful in other medical industries.
I'm going to interject a little bit. And so I think we have about 7 minutes or so left, and I would love to have some more conversation around how the existing COVID virus and pandemic has affected us, and then also allow for questions from the audience, if that's okay. Can you speak to the three of you? Like, for me, I've observed there was a reticence, I think, in acceptance of telemedicine for veterinarians. And I know that we have some of our advocates on there, and especially Roland Tripp. And so that seems to be accelerated from a consumer standpoint, which I think is a really positive thing, considering how many companion animals do not like going to the vet. Any other thoughts there, or Holly or Aaron?
Sure. I'll try and be quick. So the vets, we work both through the veterinary channel as well as direct to consumer, and a lot of the veterinarians we're talking to have had a reduction in their business, something on the order of 75%. They're focusing on emergency cases. We're trying to sort of let them know that we can provide them with some opportunities for doing, in-home testing and sort of microbiome restoration through capsules that can be sent by mail. But it's a big transition. We, like a year ago, did play with some of the telemedicine platforms and found that a lot of our customers, when we work directly with consumer, are older, and they found downloading the apps challenging. So I think, but the veterinarians are trying to, I think, really focus a lot on telemedicine, but it is a big transition, just like teachers found it to be.
I think that it's a great opportunity just to quickly say that I think we're very fortunate that our profession did the legwork for a few years before this happened. And kudos to all those people out there. I know some of them are on here, but I can't imagine the difference that we would have right now in our care if there hadn't been the legwork for telemedicine and vet med for the past 3 or 4 years. So I've seen that. I've had veterinarians refer to me on emergency from a telemedicine platform, and those animals were well served. So kudos to them.
Great. Can I open it up thank you very much. Can I open it up to questions to the group? For some reason, my screen has gone small, so I'm having a hard time reading the chat. If someone has a question that we'd like to ask specifically of one of the panelists. Nope.
There was one comment that I thought I'd just point out that Linda Rose wrote about with the clinical trial setup don't allow any open field data collection. Yeah, because people write in stuff that's useless. We had that learning as well. If you can really minimize open fields, because basically it's unusable data. It's just too labor intensive to go through that.
To speak to the human big data problem, just had a call this morning with a company on the East Coast that is a human med company that is actually looking for us to use our platform to help with some of the big data for COVID. And I think this is really interesting because it's not that we're special, it's just that their organizations are so big and their data is so robust, they're just asking someone to dumb it down and start from scratch, which I think is, just another tribute to startups and scale-ups being way more nimble than larger companies. So there is opportunity out there for companies to help with the data and all these problems of there not being codes and there not being organization, because when you extract it out into a smaller organization, you can start with clean data.
Yeah, and we owe it to the animal health industry to really learn from the progress that has been made on the human health side. That there are like companies like Athena Health in Cambridge, Mass, identified this issue years and years ago, and the difference being instead of 26 practice management software systems, there's something like 1,300 EMR systems in human health, and again, no standardization really. I mean, there's an opportunity here where we can learn from these kinds of companies that have solved this challenge at scale. Where you have not only between general practitioners like we see in animal health industry, but also how we interact with data transfer between specialists and general practitioners, and how we can ensure that ease of transfer of diagnostic and clinical information so that there are fewer gaps and there are fewer errors. I always think about when I go see my doctor and the first thing they give you is a clipboard, right? And my handwriting is horrible, so I'll fill out the clipboard and I'll see the GP, and he might say, well, you don't need to see me, you need to see a cardiologist because I hear a heart murmur. You go see your cardiologist, the first thing that gives you a clipboard, and it's a different EMR system, and those systems don't talk to each other. And there's 4 instances of any one of us in the medical in the medical community. So, and they're all wrong, by the way. So it's an issue.
I'll play Judy Woodruff, and so in the last 2 minutes, can each of you tell us what we will know about our companion animals that we don't know now in the next 10 years, and then we can wrap up.
I'll go. I think that we've touched on a lot of this stuff. So in 10 seconds or less, along those lines, I think preventative medicine, nutrition, personalized medicine or precision medicine are going to give us the idea of disease processes and be more preventative than we've ever thought. And I do think that we will see healthier pets for longer and a longer life expectancy in our pets just by being able to know that information, which to me is, I feel very fortunate to be a veterinarian at this time because of that.
I would add that I think there's some interesting opportunities with wearable technology, which I think is still evolving. But there are technologies out there that can now determine changes in gait or changes in animal posture that might indicate areas of pain or discomfort. And I think that's a huge learning opportunity as well.
Yeah, and on that note, I think also, of course, the microbiome can provide early warning signs of changes that may be associated with aging or the developing of various health conditions.
Great, thanks. I will wrap up now so we can end a little early, and thank you all for the discussion. I look forward to more in the future.
Thanks, everybody. Great to see you.
Thank you.
It was a pleasure. Thank you.
Thank you so much. Thank you so much, Hillary. Thanks a lot. Now, I think it's time for the Startup Pitch Fest. Sebastian, you and the team, you're on next. Sebastian, I think you're on mute.
I thought you were going to unmute me. I think we're good now. Can you everyone hears me? Yeah?
We can hear you fine.
Yeah, perfect. So it's great to see all of you. I think we have a lot of people outside of the US, so it's a fantastic event. We are about at the midpoint of the virtual conference, so I hope you enjoyed the format and you are ready for this fast-paced session with some of those brilliant startups and entrepreneurs that are reinventing the animal health. I mean, we've talked a lot about telemedicines and wearables, so you'll have a different flavor in a different format. So my name is Sebastian Lafont, more than 20 years in the animal health as global head of digital at BI, Boehringer Ingelheim, and before that, Merial. I work with many of you or many startups here today. And for example, I've worked on pet wearables, connected cryogenic D-words in the poultry field, launched Pet Pro Connect, which included telemedicine. And now I think has more than 1,000 clinic penetrated. And now I'm the CEO of Adapt First, a consulting company advising organizations on digital transformation. So it's really an honor to moderate that second Digital Animal Summit Startup Showcase for the one that are new and for the one that were there last year. I hope it will be exciting for you. Last year were the blast and an amazing run of startup. We're welcoming 4 startups today. And I'm just going to give you a reminder of the format. It's pretty simple. Each startup will have 5 minutes to present. It will be followed by a 3-minute Q&A session with our incredibly challenging sharks. I'll come back to them later. We have 2 startups in the field of precision livestock farming. We've talked a lot about it this morning. And 2 in the e-health category for the pets and horses. For me, the quality of these startups is impressive. I think we have at least 3 PhDs and many serial entrepreneurs. So we'll have Heiner for Pharomatics. He will tell us about robotics and how it will change the poultry operations. We'll have then Julia from Labby Inc. that will tell us how she will reinvent the dairy industry. Then we'll have Ben and Yael. So the presenter is Yael. Ben will be behind the scene. I hope it will work. They told me it will work, so I'm excited about that. For Mela, which has an amazing product for pets that they will present to us. And we'll have a strong close from Dorina at Piavita. She's in Switzerland, I think. And she will present an amazing new wearable for horses. As just Jamie said, those wearables are rising and some of them are getting more and more interesting for predictive health. I predict that you will find these 4 startups extremely relevant in the current context. And we've been talking about that and how lucky and fortunate we were to have some companies that really paved the way before what we are facing today. And now we're going to see about that those companies will probably be relevant in what we call the next normal. This term has been called by McKinsey, and it's not the new normal, it's the next normal. I like the term. I would like really to applaud these brave entrepreneurs that continue to bring innovative and critical solutions to market. For me, they are critical because if we look at the PLF side, as we've discussed this morning, they really help us to maintain critical food supply chain systems. And on the e-health side, they help us to stay relevant with pet parents that are really changing rapidly and their needs are evolving. Before we start, I'd like to say a few words and thanks our sharks. I think they are ready. Mohamed confirmed that they were all here. So we have Abid Moshin from, it was ex-Google X. For people that do not know Google X, I will invite you to look it up. It's pretty impressive. We'll have Imran Hake, which is at Mentos Fund and also former digital executive at Zoetis. And finally, we have Adnan Lawai, I hope I'm saying correctly, from Folio 3 and Mentos Fund as well. They will have a difficult task to select one winner. And if you were there last year, you know it was very hard for this extremely competitive event. So with no further ado and staying on timing, please help me to acclaim Heiner on the virtual stage. I think he's live from Spain. Heiner, can you hear us? Are you ready to go for this 5-minute pitch?
I'm ready to go and I can hear you just fine. Can you hear me as well?
We can hear you.
All right, so it says share, so you should be seeing my screen now, and then when you confirm that, I'll go off.
I think it works.
All right, perfect. So my name is Heiner, CEO of Pharomatics, a company that is dedicated to increasing animal welfare and productivity of farms. We work in livestock. In particular, we have started with the poultry industry. We do this because we like animals a lot, but also because we're working with a $1 trillion industry that is growing by 200 billion year on year. We've started with poultry, and if my slide would change, it would help. We've started with poultry because we are raising 60 billion broilers every year, and 3 billion of which never make it through the process because they fall ill and die. They consume 250 million tons of feed every year, 3 million of which we could easily save if only we had better digestion management. And some of them suffer bruises and scratches, and they're not apt for human consumption. we could save 300 million lives from dying this wasteful death if we had better stress management on farm. We have Pharmatics, the creators of the. Sorry?
Just to check, does everyone see correctly the slide? Because I see you in big, but I see the slide in small on my side. So everybody's okay on the slide side?
Yes,
Yeah, we can see it.
Slides are best.
Okay,
Yeah.
perfect. Sorry
Slides
about that,
okay?
Heiner.
Okay. So we are the creators of the Chicken Boy, the world's first ceiling suspended robot that monitors animal welfare and helps farmers increase farm productivity. The patent pending robot is completely autonomous, and it assesses ambient conditions, health and welfare, and equipment failures using multiple sensors, but first and foremost, artificial intelligence, deep learning, big data. What we do with the robot is, well, there's a lot of fancy stuff that we do with the robot. First, we classify excrement. So we find animal excrement and we classify them. And from this, we can see early onset of intestinal diseases. We can see that often 24 to 48 hours before the farmer, and that helps us help the farmers avoid having to use antibiotics. We also help him manage mortality. We find wet spots on the litter, which are of course relevant for polydermatitis and other diseases, and we help find defective drinkers. We do thermal comfort, air quality, light, and sound, in addition to other things that are practical for remote monitoring of the farms, as well as alerts directly on the mobile phone, of course. But the really cool thing about our robot is that we can demonstrate that investment in animal welfare actually makes more money for the farmers. In our case, the robot has a return of investment of under 2 years, and we make 60,000 euros over its lifetime for the farmer. Our primary clients are the big vertically integrated companies, because they realize that it is very difficult to get new production licenses. So they need to make more out of the existing production capacity, and that is through the use of big data, basically. And we help them with that. You know, just one example so that you understand the dimension that we're talking about. Every % decrease in mortality generates 1.2 billion euros extra profit to the industry. And we help you by providing more insight, by providing better control and increased transparency. Company was founded almost 4 years ago by these 5 experienced gentlemen with particular expertise in startups, in instrumentation, in animal health and welfare, and in precision livestock farming. We now have 70 full-time staff. And we are working exclusively in the poultry industry right now because, you know, as a startup, we need to focus. But the plans are to expand that to other species, of course. This is somehow how it started a long time ago. Now it looks a bit more like this. The team is very highly qualified, 3 PhDs, 13 masters, and some others, mainly technical still, because we are in that still in that technical phase. We are right now in 5 European countries. We would be in 6 if it were not for COVID. We are working with the producer of 1.5 billion chickens annually. We're in contact with producers of about 5 billion chickens per year. And we have our technology is so versatile, it can be implemented in about 1.3 million animal sheds worldwide, nicely growing by 1.6% as predicted by FAO and OECD. This creates a 9 billion euro market. Our particular share of that is right now is tiny because of the small penetration of robotic products in the livestock industry, but it will break through the billion euro barrier over the next 2 or 3 years. And in order to make that growth happen, we have partnered with the largest provider of farm equipment in pig and poultry, Big Dutchman, itself a German billion-dollar company. And with this, I would like to end my presentation, and thank you very much for your attention.
Sharks, are you ready for the Q&A session?
Now I'm getting a bit scared. Eh?
Who wants to start?
I'll go first. So thank you for the presentation. It's certainly a very exciting market, large market. Can you talk a little bit about the alternatives that are available, competition or other things that farmers might do to achieve the same result?
Yeah, I mean, this is a blue ocean, right? Robotics in poultry is not a very well developed area yet. There are 3 more commercial companies out there, all 3 of them from France. There is also 1 US contender that is starting up. We haven't seen much yet, but there is, at least the intention to become commercial. So there is some competition. We're not the only crazy guys doing this. But our biggest competitor right now is manual labor, right? Which is expensive and difficult to get. It's all over the planet, wherever you go. You hear complaints that it is very difficult to get workers and much more difficult to get qualified workers. And the differences between farmers are enormous. I mean, some farmers can do 1%, 1.5% mortality. But in Spain, the average is about 4%, and then worldwide, the average is about 7%.
Thank you.
Yeah, I had a question. I think you said a lifetime is 5 years. Is that the lifetime of just the mechanical part? Like, why can't the machine just last forever?
Yeah, you're absolutely right. So we had to estimate something. So the mechanical parts, they will last, for 10, 20 years, I don't know. But the electronics inside, that's the factor. And it's not like it will break. But the question is whether, in 5 years' time, the electronics that we're using is still going to be relevant. And that's why we are putting 5-year lifetime for the robot.
Hi, Heiner. This is Imran. Great presentation. 2 quick questions. As you know, and you mentioned that this is new for this space, but as we know, AI also is based on a lot of data. So how are you ensuring that the AI and ML algos that you have are going to produce results? And so that's the first part of the question. Second part of the question is, how are you dealing with infrastructure, Wi-Fi, et cetera, for these producers and farmers?
Yeah, thanks. 2 really good questions. So, getting it robust, that is really taking a lot more time than we thought, and that probably also explains why we are, 4 years down the road and only starting with the real commercialization of our products. So it is tremendously difficult to get this generalized over all kinds of farms everywhere in the world, and the only way you can get this done is by collecting data from a large variety of farms. So we have chosen for our installations, a large variety with different characteristics of the farms to make sure that we have enough data. And then it's a lot of work, So, we use all kinds of resources for labeling. As you can imagine, this is both internal but also external. Mechanical Turk, for example, we use that in order to label large quantities of pictures so we get enough data. Wi-Fi is also a concern. It depends a bit on where you are. So there are some countries where it's better, some where it's worse. We have made some experience with satellite Wi-Fi, which is now available in many places for very reasonable prices. But the main tool for us is that we run the AI actually on the robot itself. So we do edge computing and thereby greatly reduce the amount of data that we need to transmit. So we can live on a 2G connection. Remember before 3G, there was 2G, So on a 2G connection, we can survive. You can't transmit a lot of pictures then, but we can do our job.
Okay, maybe, and sorry for this very, very tight format. Maybe one last question. I know, Abid, you may want to have another last question or no?
Sure. Can you talk about, you're starting with poultry, that's great, but can you talk about other ways in which you can expand or use the same technology into something else, new markets?
Yeah, it's going to be livestock, right? So we are working on livestock. That's right now is the at least our description. So we will go to other species of livestock, pigs in particular, large group houses, pigs. That's also very much feasible from an economic point of view with our technology. In dairy, there is a bit more already present. So there's a bit more technology already in the space. So probably we will not go for dairy first. But then there's also cattle, of course, but this is, we are working right now on in-house. This does not have to remain that way. So we have the robot hanging from the ceiling because that gives us access to the animals from the first to the very last day, which is not true for a floor-based system. But in cattle or in other animals, this is a different game.
Okay, thank you so much, Heiner, for the great presentation. Thank you, the Sharks, for the questions. Let's try to move to Julia now for Blabing. Julia, can you share your screen? Are you all set up? And please, just housekeeping-wise, at the end of the presentation, if you could stop share, this way it will be easier for everyone to talk. So as soon as you're done with the presentation, stop sharing. Julia, we can't hear you. Maybe you have to unmute.
Yeah, here I am.
Are you good?
Yeah,
Yes?
let me share my screen.
And remember to stop share at the end of the presentation, please.
Great, thank you. All right, just a little logistic. Can everyone see the screen?
Yes, we can.
Okay, perfect. So good morning or good afternoon. Thank you for everyone. So my name's, give me 1 second here. All right. Sorry, just little. All right, just start over. Sorry. All right, can everyone still see it?
Yes.
Okay, perfect. So good morning or good afternoon. So thanks mentors and sharks and the audience. My name is Julia. I'm the CEO of Labby. Labby, born of MIT. We are building solutions that address 32 billion annual loss in the dairy industry. So many of you might have never been to a dairy farm. A farmer works long hours to produce the milk we need, and they often struggle to keep their dairy cows healthy from mastitis. Mastitis is, by the way, is other infection for dairy cow. So mastitis is the most expensive disease among the dairy cattle. It reduces milk yields and milk quality. And even worse, symptomatic cows spread the mastitis among the herd and cause milk contamination in the supply chain. So why does this matter? Because the farmer gets paid based on milk production yield and quality. So loss from mastitis is up to 10% of dairy farmers' annual revenue. That is about 1.8 billion loss in the US alone every year. So currently, farm only get milk testing for each cow only once a month. And between the tests, farmer really have little indication as to which cows or how many cows are sick. And even worse, one sick animal can contain entire delivery of milk. So that is why we created Labby. Our technology enables rapid, cost-effective, and lab-grade milk testing. It provides milk composition and quality information, including milk fat, protein, and somatic cell count. The results can be viewed on the web or on smartphone instantly. This allows farmers to easily identify cows with asymptomatic mastitis and limit the transmission to the rest. So the quick demo, you can see how our product work in the real life. So farmer was for, yeah. So our device work on the farm. Farmer can pick up a cow milk from any cows and insert into our device. In just under 10 seconds, the farmer got the results for the cow. So this helps them identify which cow is sick. And for farmers with tens, thousands, or hundreds of thousands dairy farms, being able to automatically identify the sick cows among the herd is critical. So our inline sensing device just completes the process. In our fully integrated device, we'll Once integrated with the existing milking system, and each time when the milking starts, our device will test milk quality for every single cow and red flag any abnormal results, so that farmer can precisely pinpoint the symptomatic cows. Now, all of the data generated by our lab device can unleash the power of precision dairy, providing insights on herd health and farm operation that is urgently needed for the industry. We charge a subscription that is comparable to the existing monthly testing. So for the same amount of money, farmer can now get a direct, get daily checkup rather than once a month. And our pilot partners include, So farmer pay, right now they pay, each mastitis costs about $500 per case. And we charge $1,500 per hardware and $5 per cow per month. So farmer can really get the money back within a few months. And ROI look from each year, we look at from daily spending, daily cost. So the ROI for the farmer is 6 times. There are 250 million cows worldwide, including 23 million in the EU and 9 million in the US. Our total addressable market is 12 billion. And our end of year target run rate is right now is about 500K, 500,000. In just 3 years, we expect this to become 5 million. Our demo project partners including multinational dairy companies such as Dairy One and Delaval. Since our early launch 9 months ago, we already have 3 customers already on board, and with 5 more signing up this quarter. So we're a team of entrepreneurs from MIT. Together, we have over 20 years combined experience in engineering, sales and marketing, and management to lead the company from lab to the market. So Labby has a proven method of stopping 32 billion of annual loss in the dairy industry. We have satisfied customers who love our technology, and we're on track to 10 times revenue next year. As they say, milk does the body good. So Labby is here to protect our food supply and help deliver the healthy milk for everyone.
Great job, Julia.
Let me stop sharing.
Yes, the sharks, are they ready? Who wants to start? Imran. We can't hear you, Imran.
Can you guys hear me?
Yes.
Can you hear me? Oh, okay, sorry about that. Hi, Julia. Nice presentation. I have 3 mini questions. The first one is for your testing, is it sample testing or you have to test all the milk from all the cows in that parlor? That's the first mini question. The second one is, are you only testing for mastitis or other diseases as well? And then of the customers that you have, are there any paying customers or it's just early pilots?
Yes, good question. So let me answer one by one. The first one is a bulk tank level testing or per each individual cow. So we can do both. We have this portable handheld you see in the early demo part of, right? That's just like your smartphone, very small. You can hold anywhere, paired with your smartphone. So you can do that per cow. If you have suspicion some cow is sick, you can just put milk in. You can also test on the bulk tank level. We got a lot of inquiry from South America because they like to have their own records. They don't believe the records they got from DHI is fair. But we also have inline sensing. Inline sensing is more fixed, that's attached to each milking post. So every time, that's how we're able to automate the testing process. Every time the cow come in, work with RFID, we can precisely tell which cow is actually had a higher SCC or subclinical mastitis. So second question, I think, is you asking about I forgot. Second device is regarding. Second question regarding.
If mastitis is the only disease you're testing.
Okay, I got it. So we test 3 metrics: milk fat, protein, and somatic cell count. So for dairy cow ketosis, that's indication, the ratio between milk fat and protein, that ratio directly connect to the ketosis. So we have actually paid the customers, your third question, we actually had paid cost from AgriCane. That's exactly use case, because right now there is no feedback between feed efficiency and the output from cow, which is the milk, right? So that actually we thought would just like take days, weeks before you see difference. We learned that take just maybe a day, same day or next day. Anytime of the feed change, you're gonna see quality milk production or milk quality change. So that's, we do provide three metrics. We do have a plan down the road with AI, with the data we collected. We can even predict, right now we don't have a bacteria, but we do, that's our planning for the next year. So currently three metrics: milk fat, protein, and somatic cell count.
I'm just worried about time. Sorry for that. We are a little bit more than the 3 minutes. Maybe one more sharks.
Okay.
Quickly, last question.
I can go. So can you talk about like any competition, but and also including any preventative medicines? Can you do something so that makes the cows more resistant to having this infection?
We do have a competitor is from Canada, Canadian company, but we tackle the problem from different angles. So we all solve the mastitis issues in the dairy industry, and they're a few years ahead of us. But based on our customer testimony, our solution is effective. In terms of the treatment, we actually do not get into the treatment, but we can help the dairy farmer reduce their antibiotics use, because that is early detection, right? Early prevention. So so we do that, but we don't get involved with the treatment.
Thank you, Julia. I love Labi. She sold me on the company because she says she loved milk, and that was the reason why she's really working on this project. So fantastic entrepreneur again. Again, in spirit of time. So now we are going to make that difficult transition where we have one person moving the slides and the other one speak. The team, Mela, with Yael and Ben. I don't see Yael. Is he ready? Can you hear us, Yael?
Yes, I'm ready.
You're ready. I see you now. I feel comfortable. My heart was racing.
Yeah.
So, Yael, the virtual conference is yours.
All right. So, hi, everyone. This is Biggie. He's relaxed and happy at home right now. But when my co-founder, Ben, took Biggie to the vet for the first time, they took him out of the exam room into the back and had to hold him down to take a rectal temperature. And that really made him sad. Now, what if I had told you that you had to bend over to take your body temperature? You wouldn't be happy about that either. This is how pet temperatures are taken today. So my name is Yael, and I'm the Chief Technology Officer of Meetup Pet Care. And I have over a decade's experience in developing healthcare hardware. I'm here with Anya, our CEO and award-winning leader, and Ben, the COO and driver of these slides right now. He's also a great door opener. Our last company expanded to 3 continents and was acquired by Bosch. So introducing the Meetup Pro thermometer. It's comfortable, it's fast, it's accurate. Measurements are taken under the foreleg at the axillary artery, which means that there's no more bending over. With a click of a button, you can read the temperature and send the data everywhere. Our companion app tracks historical temperature data, and we also have integrations with telemedicine, wellness platforms, and practice management systems. We're the first thermometer that can send information to them. Not even a human thermometer can send information to the EMR, the medical record. So Meetup is powered by machine learning. This is a reference to that episode of Netflix with the robotic dog. It's powered by machine learning and AI algorithms that use breed-specific data to predict the temperature within plus or minus 0.5 degrees, which is clinically viable even to the FDA. The Meetup saves them several minutes on every visit to let the vet focus on what they do best. Examining the patient and talking to the client, you'll see that screen, that's VetSpire. It's one of the EMRs that we work with, the PMS systems that we work with. And my co-founder, Ben, again, he's at a vet clinic right now. He just gave a product demo, and they're all really happy because there's finally an easier way to take pet temperatures. So our product roadmap includes a body fat analyzing scale, which both Nestle and Mars are interested in, and a pet pulse oximeter and EKG. But speaking of Biggie, he's actually the namesake of our second product, which is a body fat analyzing scale that helps address the 60% of pets that are overweight or obese. There's 120,000 veterinarians in the US and 200,000 in Europe. There's 170 million households that have cats and dogs, owning a total of 390 million cats and dogs. And this pandemic has proven that telemedicine is a viable alternative. We're in discussions with Vet AI, Petstock, and Ask.vet, who are the market leaders with over 4 million clients. And their research shows that 70% of pet concerns can be resolved without a visit to the vet. And that's why they want Mela for every single one of their users. The next product, this Mela Home, it's the home user version, it's slimmed down, it's powered by the phone, and it takes the temperature in 10 seconds. Same thing, axillary artery, and it'll be released early next year. So to date, in conclusion, we have received 200 pre-orders in the 3 days of attending the VMX show in Orlando. And by launch, we'll have integrations into 4 practice management platforms. That includes the biggest ones, Covetrus, IDEX, Vetspire, ProVet, EasyVet. Contracts with 2 of the largest pet supply distributors in the US, and that includes Patterson Vet and Jorgensen Labs. 3 telemedicine partnerships that can reach a potential of 4 million customers, and 3 retail chains, and that includes Petco, Amazon, of course, and Petstock, which is in Australia. And our channel partners' research and development and key integrations are currently in place, and we're expected to launch this product in Q4 with veterinarians and early next year with consumers. And our partnership ecosystem, of course, includes mobile vets, insurance, telemedicine, and more. And these partners are really going to help make a big difference in the quality of life for all pets, helping them live longer, happier lives while reducing the cost of ownership. And our mission aligns with 2 big movements right now. One Health, which is the goal of achieving optimal health outcomes, recognizing the interconnection between people, animal, plants, and their shared environment, as well as fear-free, because when you take a temperature under the foreleg, it's less scary than rectal. In fact, it's fear-free. So in conclusion, ears and rears are out, armpits are in. So if you believe what we're doing and want to join us and help us change the way we care for our pets and monitor animal health. Thank you.
Well done, Neil. Well done. Sharks, Q&A. Who wants to start? Abid. I know Abid wants to ask a question. I see him. He wants to ask a question.
No, okay, fine. I can go. So when you showed the slide with the product, I thought I saw a bunch of other things, and one of them had a rectal label on it. So is it just the armpit thing, or is it other? Does it come with other attachments in case you need it?
So the base module, which I'm holding in my hand right now, supports 3 probes. So you have an arm sensor right here. So like when I turn it on, I can actually show. You can actually you can see that the doggy the arm lights up, right? So the arm is lit right now. So if I switch to the ear sensor, same thing. You can see that. Oops, turn it back on. So the ear is lit up. Same thing with the rectal sensor. So we do support all 3 because some veterinarians are old school in that they want to take a rectal temperature just to be sure. But obviously they still want the ability to be able to write back to the PMS software. So we don't want to stop them from doing that. That's what they're comfortable with. Because at the end of the day, it's all about being able to, take the temperature measurements correctly, no matter what method they prefer. But in the home edition, that will only be axillary because pet owners themselves generally do not want to have to take temperatures by sticking something up their pet's butts. So that's my temperature right now, 97.3 degrees.
You pass.
Thank you.
Any other question, Adnan? Yeah.
Yeah. What's your revenue model? Like, who pays for this, and have you modeled out kind of by number of users and so forth over the next several months?
Yeah, absolutely. So our retail price for the veterinary version is $120. And for an additional annual subscription fee we're still figuring it out, between $20 to $50 a year. It allows, we build in the integration to their practice software per device. So that's our professional model. For the consumer model, which we're still working on, obviously you only saw a rendering. That one, we're still figuring out what are the levers that will get people to pay an annual fee for the software. But the per device cost will be about $50. So we're still in the process of working out the full model, the revenue model for the consumers. Now, if we have our body scale, which is the next device, which is more consumer focused, live, then that makes it an easier sell because they have to constantly keep track of the animal's health if it's overweight. So it's really an ecosystem of products that contribute to our own collection of longitudinal vital signs data, which then we will have an agreement with companies like Nationwide or Trupanion to sell to the insurance companies.
And just a quick
I had a quick question. Sorry, go ahead. Go ahead.
Yeah, so just a quick one. Do you have, I wasn't clear on whether you have some of these devices deployed, and do you have feedback, or are you still waiting for that?
Ben, can you launch the presentation back up? So there's a slide, in the slide, we're projecting a launch window of around December of this year for the professional version, and the home edition is going to be launched Q1 of 2021.
Very clear. If you want to maintain the time, Imran, if
Just
you have
one quick
very,
question.
very short question. Short. Not three questions at
very
once.
short question. Okay, one question. So let me just challenge you a little bit. So, this is one of many things that could be automated in a clinic. As we know, veterinarian clinics have a lot of pressure, a lot of new devices. Is this not just a good to have versus a must have?
Well, it is completely automated. If we have a longer time to do a longer demo, I can actually show you our end-to-end integration, which already exists with Vetspire, which is what we've already been demoing that to a bunch of clinics. We have 200 pre-orders because they already see the value. The ROI on this is less than 1 day because they're saving hours of time, and the data automatically transmitting from our mobile app to the practice management software. So you don't have to walk across the room, forget the reading, and then have to come back and measure it again, which happens all the time. It just automatically writes it into the exam.
Time is up. Great job, Yael and Ben. Great presentation. Great job, the chart. And just to close this one, we have another amazing presentation from Dorina. Dorina, I saw you disappear. No, she's here. Can you hear us?
Yes, I can. Can you hear me as well? Perfect.
Yes. Are you ready for it?
Absolutely, more than ready. Hi, everyone. It's great to see you. Unfortunately, only digitally, but well, that's the way we do right now. So let's jump in. Sharing my screen. Can you see?
Yes.
Perfect. So my name is Dorina. I am the co-founder of Pia Vita, and last but not least, we are caring for horses. So we focus on remote monitoring tools for equine veterinarians. And how do we do that? We observed in the equine clinics, probably not only in the equine clinics, but that's what we focus on, to digitize structures, processes, to reduce the time that is spent for every single patient in the clinic to just get a rough insight on how they're doing. We also face a little bit the very demanding client base. I guess all of you, and especially among veterinarians, it's known that the horse owners are probably one of the most difficult ones. And we also tackle the challenge. Now my video is gone, I think. Can you still see me?
Yes.
Okay. We also tackle the challenge that so far the insights and diagnosis possibility were most of the time based on very short-term recordings that the vets do when they are standing basically next to the patient. And how do we do that? So we started with a sensor unit, basically, or with a self-developed sensor triangle, which is now complemented with several other sensors. So this is how it looks like. The size is approximately palm-sized. That is wrapped around the body of the horse, and then the data that is collected is transferred completely wireless. It's attached on the fur, so it's completely non-invasive and does not interfere with any regular behavior of the horse. So it's completely objective recordings over a long period of time. So you can just leave it on the animal and leave the animal alone as also. We give the veterinarians a holistic insight into their well-being, starting with ECG and then heart rate, RR intervals, activity patterns, body core temperature, respiration patterns, respiration rate. So we go more and more also in the evaluation of those signs that we collect over time. It's continuous measures, so we can also track very nicely progress of these indications, for example, overnight, over longer periods, post-operative, isolation care, and so on and so forth. So these are, again, the patterns, and then the software part, which then visualizes all of this. We offer automated reports, we offer interfaces to experts, so you can also kind of outsource some of the work that you normally have to do manually. There are analytics and diagnostic tools, so we do not do diagnostic per se, but we can give targeted insights to say, okay, this seems to be an abnormality, and you might consider looking a little bit closer into this. And we also offer smart alerts. So based on every individual patient, you can set different alarm constellations to say, if there is any incident, for example, throughout the night, the one who is responsible to do the night shift will be alarmed remotely. The main application fields today, most and foremost for sure, is the continuous monitoring. So if you think about night monitoring, which is still so HR intense, which is always a little bit a struggle to enable, post-operative, of course, a lot of colic patients, anything that has to do with pain, intense care, and quite some isolation units that we've equipped now. As said, long-term monitoring, so it's completely uninfluenced. It's without any white coat effects. The horses can really be in their natural surrounding, and we also see that they are now faster referred back to their home stables, especially for recovery, because they can still be monitored without the heavy workload in the clinic. It's more and better service, of course. Not a lot of driving vets can offer an ECG analysis, for example, or really a cardio analysis, which then is the close connection to telemedicine, of course. It's objective documentation, so we have more and more clients who now also use this for pre-purchase investigations, because it really adds an additional layer of saying, okay, I did not only evaluate it myself, it's also an objective documentation, and I'm pretty sure I didn't miss anything there. And it's a fast and easy supervision. I mean, you really just plug it on the body. That is done within a few seconds. The horses respect and accept the belt very, very well. And you can just leave them and check on them from wherever you are and have some insights within a minute. This is a little bit small, but still I'm very, very proud of all the testimonials, which actually is one of the benefits, if we can talk about some positive effects of COVID, because people have more time to talk with us, about us, and we received really amazing feedback, especially during these times. Just as a few examples, they were able to reduce the time to do a checkup by half. They can remotely monitor without any problems with social interaction with the owners. They can really reduce the time spent right next to the patient. These are a few use cases. I could talk about ages about our clients because they're fantastic, but I will skip this for now. Happy to answer any questions. Here you can just see a few of the top use cases that they use it for. These are just as an example, UK and German clients. We today have equipped 60 clinics, purely equine clinics and equine practitioners in 7 European countries and in the US. We have started selling early last year, and coming also again to COVID, we have always engaged very, very intensely with our clients. And of course, the whole recording is the recording scope, and the more data we generate, the better all the measurements get. and the more we can also provide in insights and for cumulated research. We have hugely celebrated that we recorded over 1,000 hours of recordings by our clients in February, and had no clue what impact COVID now actually has on our business. So we have now seen in the following months a continuous, really, really strong increase in recordings, which proves again that digitization just experiences a really, really strong push in the whole industry. And I do hope that the veterinary industry overall comes out of this way stronger and kind of a little bit updated out of this phase that we all struggle with.
Time is up.
Okay, time is up. All right.
Sorry about that.
No
I
worries.
have the boss ringing the bell saying only one question for the sharks. So, you know, choose well. I don't know who wants to start, but one question.
I have an easy one to start with. What's the monetization revenue model? I don't think I got the price or subscription or something like that.
No, absolutely. Yeah, we do a setup fee. So we help the veterinarians to figure out in their clinic what the biggest application areas can be. We normally start with intense care units and then help them with setting up. So that's basically hardware fee together with consultancy, let's say, to see how they can best leverage and then have a fast return on investment, which is normally 6 to 8 months. And then there's a subscription on an annual basis to have access to all the data, export, download, and so on and so forth.
Good. Well, congratulations. I cannot thank enough all the startups. I think was very excited. I got a lot of positive feedback on the side, and amazing job. Thank you so much for playing the game. Just for process standpoint, we will communicate back, of course, to the entire group who was the winner this year. And going forward, we hope that we'll be able to leverage those virtual format maybe for more opportunities for Startup Showcase. So stay tuned. Thank you. And now back to you, Danish and Mohammed.
Thank you so much, Sebastian. That was really nicely done. That was a fantastic pitch fest. Well done to all the startup presenters and entrepreneurs, and well done to the judges. I think the sharks let you off nicely, but I think your presentations deserved more appreciation than bites. So well done, everyone. So we're going to go to our final session and conversation. I'm very excited about this. I'm welcoming Martin Goosens of Entera Capital and Spencer Swayze of Payne Schwartz. Martin, Spencer, are you guys on?
Yes, with you.
I am on.
Brilliant. All right. So it's been a fantastic morning here for us here in California, and I guess afternoon, evening for everyone else. We have a really good crowd. We're going to get started. Martin, tell our audience a little bit about yourself and Entera, and then I'll have Spencer do the same.
Sure. Martin Goossens, Umar, thank you very much for having me in this new digital environment. It was a pleasure to be there last year, but even more excited this year. So my background, I am one of the founders of Entera Capital. Entera was set up about 7 years ago, and our focus is on having a global impact on health and nutrition across plants, animals, and humans. So we're a specialist venture capital fund with about 250 million under management. We do anything from company incubation up to Series B investing across mostly the US and Europe. We have an investment in India as well, so Asia is definitely part of the remit. Yeah, and I think with that, I would probably pass over to Spencer for a quick introduction.
Yes,
Spencer.
Hello, everybody. Thanks for the opportunity to be here. Certainly, appreciate this session, and like most, I'm learning how to do these types of sessions through Zoom, and am enjoying that. I'm a managing director at Payne Schwartz Partners. I joined the firm a little over 3 years ago to help launch and lead our growth equity investment strategy, and I now operate across both growth equity and buyout strategy. Payne Schwartz Partners is a food and agribusiness sector focused investment firm. focused on sustainable, food and agribusiness investment opportunities. We currently raised our fifth fund. It's a $1.4 billion fund. Approximately 20% of that will be, targeted towards growth investments. The other remaining 80% towards buyout investments. We have a, very flexible mandate in how we actually structure and work alongside entrepreneurs and founders and owners of businesses. Very much like Martin, our focus areas are improving productivity, supply chain efficiency, and health and wellness. We invest in the OECD headquartered businesses, so that primarily consists of North America, Europe, and Australia, New Zealand. That's been where we've historically invested and operated. I also lead our animal health and nutrition investment strategy within the firm, and looking forward to having conversations with everybody on the line.
Brilliant. Thank you so much, Spencer and Martin. I'm going to start actually on a slightly different note. Obviously, it's been a tough few months for all of us, but I want to start on sort of a positive here. So I'll go with you, Martin, first. What in all of this, on the personal side, has been kind of an unexpected silver lining? Like, what's been an unexpected blessing amidst all of this new reality?
Yeah, I'm not sure if it was unexpected per se, but I never experienced something like this. But my dad actually ended up in the ICU due to COVID. I'm very happy to say to everyone here that he got out at the good end. He's 75 years old and he's recovering very well. But I was amazed by all the support we as a family got from everywhere around the world, friends, family, professional relationships. So although you're sort of kept away from each other due to the COVID situation, I think for me the silver lining was that through technology we're actually very well connected still.
Sounds good, Martin. Spencer, how about you? Share a silver lining.
Yeah, so look, I think on a personal note, for me, I historically travel about 80% of the time. And so I'm, virtually, at home on the weekends and on Fridays. And so I think for the first time in the past 10 to 15 years, I've been home, I think 9 or 10 weeks in a row now. I've lost count. And so, as a dad with, 3 young children, I think that's been a very positive thing for me to be able to be around. I wouldn't say that I'm working less. I'd say that we're all working more. The Bloomberg article that came out and said, the average person is working an extra 3 hours a day. I felt like, I got the short end of that stick, but it's been a lot of fun being able to at least be home and, at the dinner table, more often than I have been in the past. So that's the glass half full, point on the personal side. I think on the business side, I think one of the, the positive things we can continue to think about is that, these types of situations, environments, even though this is unprecedented, give you the opportunity to think creatively and out of the box, with new investment strategies, as well as with, existing portfolio companies to see if there's ways to drive more efficiency, new ideas. And that's what we've been spending a lot of time on. I think you can look at it as a positive in that respect.
Okay, fair point. So let's talk about COVID-19's impact on investing. And I'll start with you, Martin. How do you think this pandemic has impacted early stage investing, particularly in the animal health space?
I'll start with some more general comments in VC, which obviously also relate to early stage investing in animal health. I think one thing is that we have now seen that there's a drop in venture capital investing of about 25%. Compared to where we were last year and where things were going back in, say, Jan, Feb. So, I guess that is an indication that the markets are focused more on their own portfolios, right? Which is a logical thing. So capital reallocation is on everyone's minds. But now you also clearly see that in that drop. I think the other issue that I see for startups is, although I like the interactions here via video, before you invest, you tend to want to meet a team in person. And so, we don't really know when the situation is going to end and when you can visit people. I think a lot of deals were still closed that were sort of at the end of the process where people had already met each other. But at the moment, I think new conversations, new opportunities are more difficult to close. I think specific to the area of animal health, I would say there are areas that have seen a boom or an increased interest. So one category, which is not on the digital side, but clearly on the animal health side, is vaccines. Vaccines were always a bit disregarded and seen as an uninteresting asset class. I think that vision has changed more broadly in human health, but with the One Health concept, clearly people will think about animal health as well. And then the other area, which is in the digital context, is the offtake of telehealth solutions, where we already saw certain areas of the world move faster than others in accepting the use of these digital tools, either through chat, voice, or video-enabled telehealth consults. And that has now been expedited. I think the FDA about a month ago also came out with a relaxation of the regulation in the US for consultation through telehealth. And this will only be the start for a further boost. So that's a category in and of itself that we're spending more time on. We were already spending time on that, but there's a couple of deals we're actively re-engaging with because you see that they are basically flying like we've seen with e-grocery and other categories. Let me stop there.
Sure. And actually, there's a comment from Dean Lairmore from UC Davis that do you think the pandemic will drive more remote monitoring devices in companies to the point that you were just making? Do you see that though that class of companies in remote monitoring and I guess telehealth and so on getting much more of a boost from the venture capital capitalists?
Yeah, so I think the remote monitoring in and of itself will definitely increase. It depends really in which context. I think in a farm animal context, it will always be economically driven. And so if there is a good, strong economical value proposition before or post-COVID, that's going to sell in any case. So I don't think COVID is a driver there per se. But in the companion animal space, I think it is because one, regulation relaxation helps. Secondly, people all of a sudden becoming more comfortable interacting through things like Zoom. I think on the one hand, you have vets that don't like to work with digital tools. I think that has changed due to this environment. So I think people will be more comfortable in the use of these tools. And I think there we will definitely see a COVID effect.
Got it. So Spencer, how do you think COVID-19 has impacted sort of more late stage investing generally and then specifically in sort of ag and animal care?
Yeah, so look, I think the investment strategy that we have of looking for high quality businesses, continues to remain, persistent and consistent through COVID-19. Certainly as you look later stage to large cap buyouts or buyouts where you need syndicated debt, if those debt capital markets are closed, it's difficult for private equity sponsors to, look at that threshold of, businesses in the same light. So it seems to be moving potentially towards more, equity type deals or, private credit type of, opportunities. Certainly in addition to that, there are certain sponsors that, we're anticipating or planning on, exiting a business in a certain time frame. Those sponsors may not, be as interested in trying to, sell a business or exit a business during COVID-19. Many, the points that Martin just made make it difficult, right? If you're going to try to do due diligence or go through a auction process, how do you do that in an environment where you don't get to meet the management team, you don't get to tour plants, facilities, do that kind of fundamental due diligence that makes it a challenging environment. That being said, I also think that there's, a lot of ways to be, creative in how you pursue, investment opportunities in this type of environment. We're looking for businesses that are high quality businesses where we can either help them in the event that this type of environment can, be a challenge for them in a short-term setting, because we want to be a strategic capital provider to the industry. In addition to that, there are, certain companies who may be very well positioned in this environment and looking for, capital to do an M&A strategy to pick up some of those companies that, might be great strategic fit, and in a situation where they don't have other sources of capital. So, I think it's, moving a little bit in terms of how you actually structure and think about a deal. On the animal health side, I think that, the points that Martin made are, fantastic points in terms of where you see interest and activity. And certainly vaccines have been on our radar for some time. We think that's an underappreciated asset class, as Martin pointed out, maybe more interesting, even in this environment. In addition, I think, on the digital side, when you start thinking about, we kind of frame digital as precision livestock, meaning both hardware and software type solutions. You start thinking about, embedded, technologies in a production system that can help enable traceability. You can help think about food safety. Also think hygiene, sanitation type of solutions, are becoming important. And this highlights, especially what's happened in packing, plants, downstream on the processing side of the industry are important. And then, you also think about robotics and automation as possibilities, in a plant where you might have, challenges with labor in this type of a situation. So, we continue to be interested in pursuing a lot of opportunities. And, I think the thing is you need to be a little bit creative in this environment to, get activities done. But we are focusing tremendously on, portfolio companies. So, a lot of time is being spent there as well. I'd say the bulk of our time is making sure that, employees in our portfolio are healthy and safe. And then on top of that, that we're, seeing ways to, drive growth in a very different environment than what we all saw at the beginning of the year.
So actually on that point, Spencer, with your portfolio companies, what sort of challenges are you seeing? What advice are you giving them, obviously to sort of survive the next few months, but then also thrive post-COVID?
Look, I think historically, when you look back to global financial crisis, the GFC or, other environments that, you could try to stay or similar, the one thing that, comes about is, efficiency and cash is king, right? And so, try to make sure that you're thinking very thoughtfully about how you leverage, the resources that you have, the capital allocation decisions that you're making.
Looks like we may have lost you there, Spencer. Yeah, it could be the Wi-Fi connection there. Martin, are you still with us? Yeah.
Yes, I am. Right? I am.
Good.
Yes.
I was actually going to just put that question to you any case. We'll wait for Spencer to come back. But for your portfolio companies, right? You've got a bunch of startups. Tell us about them. What are the challenges? What are the defensive and offensive strategies that you're sharing with them?
Yeah, so I think one of the key things, just to follow up on Spencer's cash point, is that in the world of venture capital, you go through funding cycles. Some companies you fund for a year, some you fund for 2 years. So one of the key things that we focused on when COVID started to hit, so probably sometime in March, we got together and we went through each and every portfolio company to think, okay, how can we get them on a 12-month runway? Because we don't know how long this is going to take. We're sure as hell not going to go out in the market right now because that's not going to be a sensible decision. And so can we help them ourselves, or can we get through government financing support for our businesses? So that was the main key reaction as of day one. I think we have been lucky with most of our portfolio companies, knock on wood, that they have been active in crucial industries. So we're active in agriculture and animal health. And those categories often were able to still continue to operate. So that was helpful and actually different from other businesses in the venture space, which were seen as less essential, so you will. So it seems we're actually focused on essential industry, so that's a good thing, I think. And then I think the other thing there is that people obviously have to eat, and people care about their pets like their family. So those are key driving factors behind that. In terms of, so what have we been telling our portfolio companies? We've been sharing a lot of best practices. We have had best practices come from contacts in China. So we were really following best practices from Asia to Europe to the US, and making sure that across the Northern Hemisphere where we are involved with different companies, we were sharing those best practices. And then I think in terms of the opportunities, so for us, we have quite a few companies in the area of digital technology where they are selling either products or digital solutions, and often into more antiquated industries such as agriculture, for example. The thing that COVID really pointed out is that without these type of digital platforms, it's very hard to do business. So we've pushed them to really drive their either products or digital services in this period, and think about developing new ones or creating new business opportunities in that context. And follow up on that last point is what is really happening on the M&A side. Are there opportunities out there, cheap assets that we can pick up, companies that we always like but were too expensive? So that's the other strategic thing that we are thinking about.
Got it. Okay, good. And Spencer, you're back with us. So I just thought if you can finish off your point on how you're advising your portfolio companies, and any sort of thoughts you want to share with other businesses out there. I see Spencer here, so.
Yeah, I apologize. I had a technical challenge, and it kept kicking me out, so I apologize for that. One of the things we get to deal with every once in a while. The funny part about it is that I actually live in the heart of Silicon Valley, and my internet access is sometimes poor, and my cell service is also poor, and everybody in my neighborhood has the same issue, which is a bit ironic. Were you asking me a question?
Don't go about improving technology all the time, right? Because we suffer from it, right? Here in the valley. No, but I was just asking if there are any other points on what you've advised your portfolio companies. Obviously, you're looking at much bigger companies, but just offensive, defensive strategies that you share with the audience, just quickly.
Yeah, and I apologize if this is repeating myself. I thought I had been answering the question, then all of a sudden Zoom disappeared. But I think we're staying, very focused with our portfolio companies on, trying to be as efficient as possible, with cash, with capital allocation decisions, to make sure that we have, the dry powder to weather the storm, and that we're prioritizing those investments, appropriately. The first and foremost, key strategy we're focusing on with our portfolio companies is making sure that, employees are safe and healthy. And, that's critical, because those, human resources are the most important asset of any company out there. And, when we look back at, GFC and other, situations that could be, in parallel, or compared to this situation, you want to make sure that you are, making sure you're driving cash flow. And, free cash flow is very important in this type of environment, and, trying to make sure you weather the storm. So we're spending a lot of time looking at different scenarios on a forward horizon basis to see what could happen in various different economic environments. Forecasting has been a big part of our work stream, and, really understanding, what we need to do to make sure that, we come through very well, and that our companies still perform and can, hit a really nice growth trajectory when we come out of this pandemic scenario.
Well, as we get questions and comments from the audience, I want to pose to both of you, kind of, since you are the prophetic experts and sort of all-seeing investors, what do you see in terms of kind of life after COVID, what's your view of, for the industry, what comes next? Let's go past 2020 and let's look at 2021, 2022. How do you see the industry changing and adapting through all of this? We'll start with you, Martin.
Sure. Yeah, so one thing that I found quite interesting to read the other day is that economic recovery in these pandemics tend to show like a V-shaped recovery. So it can be a very drastic drop, but it can also be a very drastic up again, as opposed to some of the financial crises that we've seen or the dot-com bubble. So I think that's one piece where I think we will be on the rebound, and markets will go up, and the venture ecosystem will go up. Having said that, it's not going to happen so quickly. I think we will still see the results of COVID over the next 6, maybe 12 months. With that, I expect that a lot of the bad companies will actually disappear, which is a good thing. So it will help in my job that I have to filter through less companies at the end of this. And the good thing is that I do think there's still a lot of venture capital available, and I think Spencer can echo that there's probably more broadly enough private equity available. So I think good assets will find the finance from the private markets. Beyond the financing, I think the other thing is that on the food side, I think we will see fundamental changes in our food system, either through the adoption of technology. I think Spencer stressed this earlier in terms of food safety, food security. The other question is around, are we going to see shorter supply chains because people want to make sure that they can actually take care of their own people, and what is that going to do to global trade? And then I think the other shift I'm interested to see is the alternative protein trend going to be accelerated, slow down, or what's going to happen there, and what's going to be the impact on the overall foods system? So that's it for me for now.
Got it, Martin. Spencer, your thoughts on what the next couple of years hold for the industry?
Look, I think Martin made some fantastic points. Whether this is a V-shaped recovery or a U-shaped recovery, and depending on timing and trajectory, I still believe that very high quality businesses will find their way and find financing. I think that and this is kind of in addition to the comments that Martin made. There could be additional consolidation that occurs, more rapidly, and that comes from people potentially playing more offense in this type of environment, if they're well capitalized or well suited to do so. The big thing that I think you will see is that there will be some dry powder on the sidelines until people can understand and see visible improvements, but there is plenty of dry powder in private equity, just like there is in the venture market. I think that the timing and sequencing of how it all unfolds in terms of deployment of capital into new investments might slow. But if you're creative about it and you're an entrepreneur and you have a great business, I think there's still ways to find your way to opportunities. I do think it's harder though if you're just now raising capital and you haven't ever met with the firm in person to get something done, right? But if there are already existing relationships, that can certainly happen. I think from an animal health perspective, I couldn't agree more with what Martin said. I think there's going to be a great recovery. We need protein. We need to be able to take care of our pets, and that will persist through time. There may be some slowdown in the amount of protein based on recessionary impact, as we're all seeing, or even supply chain impact. But there could be I think very good recovery as people get more comfort with how this all shakes out. I do think, I think I mentioned earlier, I wasn't sure if I got cut off at this point in time, but I'd mentioned, and Martin just highlighted it, food safety, sanitation, hygiene. I think there will be more opportunities for digital solutions, especially if they can show traceability and, give outcomes to both the consumer to understand, where their food's coming from, but also for producers to more efficiently run operations and see productivity gains. Because if we are in an environment where there's less protein demand, less protein being consumed because of an economic recession, those tools and technologies that can continue to drive productivity and efficiency within an operation, become more apparently valuable or inherently valuable. So there could be some adoption to that. That being said, there's also, an argument, if you look at the flip side, that producers might not be interested in spending, money on new investments when they're trying to make sure that they're, maintaining profitability. So I think there's a trade-off, and I think that opens up when there's more comfort and visibility into what's actually happening with the pandemic, and a better forecast on a forward basis.
Got it. Well, Linda Rhodes has a question, I guess, for either of you, but I think Martin, from your side in particular. Given that the IPO market's probably going to be somewhat sticky for the next few quarters, would you be more interested in sort of acquisitions, sort of exits by acquisition for your portfolio companies? And do you see that impacting innovation if people look to get quick exits out? Martin?
Yeah, if I see that impacting innovations, I think true innovation, which is of real value, can also wait 6 or 12 months if it has the right investors behind it, to either come to the financial markets and do an IPO. Because if you're sitting on a real gem, you won't let that go in 6 months and sell it off cheaper. At the same time, I think, will exits via acquisition happen more? I think so, probably, if people were already considering it. But again, it really depends on the timing, because the outlook of a typical venture capital investment can range anywhere from 3 to 7 years. And again, in that context, you want to wait until you maximize the value. So if you can get a good deal in the next 6 months, I would consider it. But otherwise, I would focus on creating more value in the asset, and sell it thereafter. But it could be a category like telehealth, for example, where things are booming, and actually now is the moment to sell because your top line is growing like stink. Then I would definitely focus on that and try to potentially sell it. But then again, coming back to Spencer's earlier point, you will still have the issue with due diligence processes, and so your process in and of itself will not be as smooth and as easy. And again, therefore, I would probably ask the business to focus more on generating even more top line in this telehealth example, as opposed to trying to go out and sell the business.
Got it. Perfect. So I'm going to ask both of you sort of a final question, because I know we're a little over time here. So with you, Spencer, first, and then same question to you, Martin. So obviously, both production animal and companion animal care, we've sort of had this notion that, we're very late technology adopters, right? So this industry sort of is not leading or bleeding edge when it comes to technology adoption. How has COVID-19 and this current pandemic, Spencer, done, had an impact on that approach or that ethos of this industry? Is the day of the digital denier over? What is your thought?
Look, I certainly don't think it's over. I think from my previous comments, I think that, if you have a solution that is going to be valuable for, a producer, that they will, especially coming out of COVID, that, can help them from a digital perspective, really understand traceability and productivity in the supply chain. I think this could actually accelerate it, especially if you can say, look, we've made the operation more efficient. We've shortened the supply chain. We've improved consumer knowledge on safety and welfare. I think that what I have been amazed at is the producer in animal health in general is a slower adopter than what you see in some of the other industries we're in. But I think that they are starting to be more interested in technology. You can just see by some of the leaders starting to show up at these conferences and really look into the impact of digital business. So I think it may take some time because people are actually, trying to figure out what's happening with their business today in this environment. But coming out of this, I think that, the adoption will accelerate. That's, just my guess. I'm also used to, typical question when we work on panels together of, you get one answer, yes or no, right? And so I think what I would say is yes to accelerate if it was Martin asking me the question.
Just to go back to your, sorry, Omar, just to go back to your opening statement, I actually think that the farm animal space, for example, in some cases has been ahead of technological innovation compared to other industries. If you take, for example, automatic milking systems, that is an early form of robotics, and everyone is talking about robotics now, but that was already happening 30, 40 years ago. And the other piece there, again, more in a probably dairy context, is the use of sensor technology. A company like Antelic was again built over 30 years or so. So a lot of the knowledge that has been built up in those areas is actually taken into different verticals. And so I wouldn't say that animal health is necessarily a laggard on every front. I think what could delay any acceleration here is really the economical inputs we're going to see, both for private persons in a companion animal health context. If their spend is hit, then automatically that of their pets will be hurt as well. But in the farming context, we've heard horrible stories of farmers dumping hectoliters of milk, lots of eggs, and the stories continue. And I think the main issue there is that if all those farmers are close to bankruptcy, they don't have any penny to spend on technology. And that has been an issue over the past, I guess, 5 years in the US and other regions as well, where farmers just have had a tough time, and it has resulted in a lack of technology adoption. And I am afraid that will continue as a result of COVID, unfortunately. Although a lot will tell us that we should adopt technology more so, but then we need to have subsidies or different policies in place or different people driving the adoption of the technology than the farmer in and of itself.
Okay. Brilliant. Well, final thoughts from you guys. And Spencer, any final thoughts to leave the audience with as we close out this really very fun virtual meetup? I'll go to you, Spencer, and then to you, Mark. I don't know if Spencer is. Did he drop off again? Is he still? Yeah.
He's there. He's
there.
There.
He is. There you go.
I'm sorry, I dropped twice. Martin was making a great point that in some cases the production industry, is actually very rapidly adopting products. Mine was and I agree with that point in certain categories, absolutely. But then I lost the rest of it, so I'm not sure what other brilliant points.
No. So I just wanted. So Martin made sort of a very good points all around. I just wanted to thank both of you and just leave any thoughts, Spencer, from your side. Anything you want to wish to the audience? We've had a fantastic audience with us throughout.
Look, I just hope everybody stays safe and healthy, and I appreciate the opportunity to speak with you all. I would point out that if there's anything that we can do to help or to have conversations around our investment strategy, we're very open. We love the industry. That's all we do is we think about food and agribusiness, and anytime we can talk to people that have ideas, we're very open to it. I think that this industry is fantastic. You have some, leading innovators on the, the production side. Tyson, Cactus, all of these, guys are, really, thinking thoughtfully about, how to implement programs. And then on, upstream from that, there's a lot of new tools and technologies that are being developed, and we are, very enthusiastic about, trying to find ways to partner with entrepreneurs and founders and owners of businesses to help drive success in the industry. So, feel free to reach out.
Thank you, Spencer. Martin?
Yeah, I'll close off with a final note on the companion animal space then, where I'm pretty hopeful that the trajectory of growth that we've seen the past couple of years will continue. If we look back in the past 30 to 40 years, the pet spending continued to weather the storm in the financial crisis, in the dot-com bubble. I do think we might see a little bit of a blip in veterinary care spending, which was on a trajectory of 9% CAGR the past 30 years. That's been amazing. That might see a little dip, but again, I think as we see pets more and more as family members, we will also see a continued spend even in tougher times. And that's further, I think, exemplified with the huge amount of dogs and cats that have been taken out of the shelters, which creates a whole new population and potentially even a bigger category of spend for the companion animal space. So with that note, Umar, thanks for having me. Thanks, everyone. And please feel free to reach out with any new startup ideas or other business propositions if relevant to Entera and to your ambitions. Thank you.
Brilliant. Well, I think that's all I wanted to say to everyone as well. I mean, it's just been a brilliant summit, and I just wanted to thank everybody. Thank, obviously, the Digital Animal Summit Advisory Council and all our volunteers for putting this together, our sponsors, Folio 3, Agri-Beef, and Progressive Beef. A huge thanks to all our speakers, obviously to you, Martin, and to you, Spencer, but everybody who's followed, preceded us, the startups who came before us, and then all the 120 to 150, I lost count, of all the participants that have been with us throughout. We hope to see all of you at many more virtual and in-person DAS events. Thank you, everyone. Cheers. Stay safe. Bye-bye.